Good evening all. Today, I want to share some important points regarding the OCCULO cardiac reflex. This OCCULO cardiac reflex, usually the postgraduate they will get in a theory paper. Because it's a small thing, though how to write for 10 marks. If you see this entire presentation, you can easily get out of 9 out of 10 marks if you write everything what I have presented here. So, what are the synonyms of OCCULO cardiac reflex? The blepharocardiac reflex, OCCULO cardiac reflex, and trigeminal vagal reflex, and Ashtar reflex and Ashtar phenomena. These are all the synonyms of this OCCULO cardiac reflex. So different cardiovascular reflex are there. Wherever the some nervous system that will activate the vagus nerve that will affect on the cardiac inhibitory system like basal-Jones reflex and atrial stress reflex and brain bridge reflex and Boros reflex. These are all the other some cardiovascular reflexes. So what are the standard learning objectives here? We have to identify the anatomical structures involved in the OCCULO cardiac reflex. We have to describe the risk factors of an OCCULO cardiac reflex. And we have to review the management of a patient with an OCCULO cardiac reflex. And we have to outline the interprofessional team strategies for improving the care combination and communication to advance the detection and management of the OCCULO cardiac reflex. Finally, we have to assess we have to improve the outcomes from the OCCULO cardiac reflex. So, coming to the OCCULO cardiac reflex, it was first described in 1908 as a reduction in the heart rate secondary to the direct pressure based on the eyeball. So it is defined by a decrease in heart rate by greater than 20% only following a globe pressure or traction of the extraocular muscles. So when you want to describe the OCCULO cardiac reflex, the heart rate should be greater than 20% decrease. It should be present. So this reflex is commonly results in a sinus bradycardia. However, it has also reported it has associated with the reduced arterial pressure and arrhythmias and asystole, some cardiac reflex also. So some people they will ask you what is a trade-off OCCULO cardiac reflex. So trade-off OCCULO cardiac reflex described as a bradycardia, nausea, and faintness evoked with the stretching of ocular muscles or with the pressure on or within the eyeball. So tride means bradycardia, nausea, and faintness. These three will present in OCCULO cardiac reflex tride. So when we will see this OCCULO cardiac reflex, the reflex has most notably depicted during the ophthalmological procedures, especially whenever the strabismus surgery. So it may also be activated by the facial trauma, which occurs pressure on the eyeball, and some regional anesthetic nerve block that will initiate the stretching of the muscles, and during some mechanical stimulation on the eyeball also, it will stimulate the OCCULO cardiac reflex. The incidence and risk groups are, the incidence of OCCULO cardiac reflex is reported to be anywhere from 14 to 19%, and it will decrease the age. As the age progresses, the occurrence of the OCCULO cardiac reflex will be decreases. So pediatric populations are the most risk factors, especially for OCCULO cardiac reflex. So pediatric patients are also more susceptible to the detrimental consequence of the OCCULO cardiac reflex, secondary to having a greater dependency on heart rate to maintain the cardiac output. So in pediatric patients, the cardiac output is heart rate dependent. In adults, the cardiac output is stroke volume dependent. So in pediatric especially, so this cardiac output is maintained the heart rate. If the heart rate decreases, automatically the cardiac output also decreases. It will affect on the detrimental effects on the pediatric population. The wide range of incidents and the severity of OCCULO cardiac reflex is reportedly attributed to the effects of hypoxia, hypercarbia, acidosis, and the anesthetic agents used during surgery. So let's come to the anatomy of the OCCULO cardiac reflex. So two limbs are there. One is the afferent limb, second is the efferent limb. The afferent limb consists of from here ocular muscles, from ocular muscles the long ciliary, short ciliary. They will end in the ciliary ganglion to the ophthalmic branch of cranial nerve. So from there it ends to the main sensory nucleus, the trigeminal nucleus. So it is very near to the vagus. So whenever you stimulate the trigeminal nucleus, that will automatically stimulate the vagus nerves, and it shows an effect on the heart. So the trigeminal nerve, otherwise known as the cranial nerve 5, serves as the afferent limb. So the vagus nerve is known as a cranial nerve 10, comprises this is the afferent limb. This is the afferent limb. Okay. So physiology behind the ocular cardiac reflex. So this is the pathway initiated with the activation of chest receptors in the ocular and periorbital tissues. So these long and short ciliary nerves, they conduct impulses to carry the sensory messages to the ciliary ganglion. Here they will carry. From there, the impulses are transported via the ophthalmic division of the trigeminal nerve to the gesserian ganglion. From the ciliary ganglion to the gesserian ganglion. So followed by the trigeminal nucleus, where the afferent limb then terminates with the central nervous system. So the CNS process of this sensory information, so internuclear communication, the trigeminal nucleus and vagus nucleus. The internuclear communication will occur between the trigeminal nucleus and the visceral motor nucleus of the vagus. So this stimulation of the afferent limb causes impulses exit the brains and transfer to the myocardium, synapses the SA node, and activate the vagal motor neurones. Finally end with the bradycardia. So the result effects include negative chronotropy leading to the bradycardia. So afferent activated, it activates automatically into the internuclear communication. The vagus nucleus will be activated. The vagus effects on the SA node that will decrease the heart rate. Finally, it's the bradycardia. So what are the risk factors? So the ocular cardiac reflex has been associated with various triggering stimuli, with the most common being the traction of the extraocular muscles. So multiple studies have reported the increased incidence with the medial rectus traction when compared to the other ocular muscles. Usually that will be done in the strabismus surgeries. However, there have also been studies reporting that no increase is associated with the traction of the specific extraocular muscle. So additional stimuli that have been linked to the triggering the ocular cardiac reflex to the direct pressure on the globe and ocular manipulation, ocular pain. So ocular manipulation, ocular pain, and direct pressure in the globe that will triggers the OCR. So secondary to the increased pressure and retrobulbar blocks and ocular hematomas and facial and orbital trauma may induce the activation of the reflex as well. So as a fatigable reflex, the ocular cardiac reflex intensity will decrease with the multiple and repeated stimuli. So if we do the repeated or multiple stimuli, the intensity of the ocular cardiac reflex really decreases. So what are the complications? The complications secondary to the ocular cardiac are related to the vagal response and may include sinus bradycardia, arrhythmia, reduced atrial pressure, ventricular tachycardia, ventricular fibrillation, and multifocal premature ventricular contractions, ventricular bigeminy, and sometimes asystole and cardiac arrest. Due to that, the patient will suffer the dizziness, lightheadedness, nausea, and weakness. These are all the complications of ocular cardiac reflex. So non-cardiac consequences, what are the associated with the ocular cardiac reflex? Activation of the ocular cardiac reflex has been associated with some non-cardiac consequences. With the activation of vagal motor response, other reported vagal effects such as hypotensive episodes and syncopes and gastrointestinal responses such as nausea and vomiting will follow along with the bradycardia. So the latter has been questioned to have impact on the severity of the postoperative nausea vomiting also this ocular cardiac. Especially in the pediatric population, the incidence of postoperative nausea vomiting has been reported to be as high as 85% following the strabismus surgery, and it is the most common reason of inpatient admission following the outpatient procedure. So clinical significance, when discussing the prevention and treatment of ocular cardiac reflex, its potentially devastating consequences, it is important to note that the only definitive treatment is the immediate cessation of the triggering stimulus. So if you stop the stimulus, automatically the OCR will be decreases. So when in the operating room, immediate removal of the pressure to the globe of the eye or surrounding orbital tissues can terminate this reflex. The next step of the procedure is to proceed with caution. In less uncontrolled circumstances such as trauma and cessation of the triggering stimulus can be more challenging. In these instances, pharmacological management may be required and cardiac monitoring should be initiated. whenever if you are not remove the, if you are unable to remove the triggering stimulus such as facial traumas in the situations, you have to take the help of pharmacological treatment to counteract the bradycardia and other things. So understanding the different anesthetic agents can be used to help to decrease ocular cardiac reflex, as incidence may vary with each agent used. So multiple studies have shown that pre-treatment with intravenous anticholinergics such as atropine and glycopyrrolate decrease the incidence of ocular cardiac reflex. Atropine works by blocking the peripheral muscle receptor of the heart and causes the increased firing toward the SA node as well as conduction through the AV node also. So this supposes a vagal response or the afferent limb of the ocular cardiac reflex. Though its stimulation of the sympathetic activity, ketamine may counteract the vagal stimulation causing the ocular cardiac reflex. Choi et al. Reported the lower incidence of ocular cardiac reflex when a ketamine infusion was used as a primary anesthetic agent in comparison to the sevoflurane and halothane and propofol. So as for body et al., they found that ketamine is superior to atropine in decreasing incidence of ocular cardiac reflex. Other studies are associated with ketamine with lower incidence of postoperative nausea, vomiting, and agitation also. Okay, so ketamine and these anticholinergic medications, they will decrease the ocular cardiac reflex. So blunting the afferent limb of the reflex can also decrease ocular cardiac reflex. So retrobulbar and peribulbar blocks with the gelycan hydrochloride can be used to block the ciliary ganglion. Whenever the ciliary ganglion will block, the afferent limb will be broken down. The afferent reflex will be broken down. So the patient won't be affected with the bradycardia. When combined with other agents shown to decrease the ocular cardiac incidence, such as atropine, further production of OCR activation is provided. So administration of fast-acting opioids such as fentanyl, sulfentanyl, remifenil can potentially, they will facilitate the bradycardia because all the opioids they will cause a bradycardia. Already patient with something with bradycardia, they will facilitate more bradycardia and sometimes leads to the asystole also. So many anesthetic agents have been studied on the effects of ocular cardiac reflex. Several studies for further investigation. However, it has repeatedly been reported that pre-anesthetic medication with atropine, retrobulbar blocks, or other agents used to blunt the OCR should be routinely utilized during procedures or trauma related to the eye. So this protects the patients against the potential consequences of ocular cardiac reflex. So finally, the anticholinergic agent like atropine and glycopyrrolate, and anesthetic agent like ketamine, and blocks like retrobulbar, peribulbar with the gelycan to blunt the ciliary ganglion, they will protect the from ocular cardiac reflex. So these are regarding the ocular cardiac reflex. So how ocular cardiac reflex affects? What are the triggering factors? What happens if the ocular cardiac reflex is initiated, and how to prevent by giving the prophylactic drugs, and how to manage the bradycardia also we learn through this PowerPoint. Thank you.